see there's 8 formulas in dampness category. If a patient coming with difficulty urination and fever, thirst, desire to drink, plus lower jiao, diarrhea, and also irritability, you would choose 猪苓汤. However, if the patient have difficulty urination, but in the middle jiao, he feel vomiting immediately right after drink, it will choose 五苓散. So these two is commonly compared together. However, one 猪苓汤 is for fever, desire to drink in the lower jiao. If the patient have urinary difficulty, fever, thirst, desire to drink, but in the middle jiao, he feel vomiting immediately right after drinking, then you should choose 五苓散. So it's important to know vomiting immediately after drinking is for 五苓散. And also, if a patient have urinary difficulty with no thirst, plus general edema and heaviness in the extremities, abdominal pain due to cold, which is real cold, we use 真武汤, the true warrior decoction. Moving on, frequent urination. Turbid, scanty, painful urination, all the UTI symptoms, you choose 八正散. We need to know what's the difference between 八正散compared to 八真汤. One is for tonification, the other is for treat dampness. So far we have 4 formulas, which 3 is for difficulty urination, 1 is for frequent urination. And moving on up to the middle jiao, we have 2 formulas that helps the dampness. One is heavy sensation in the limbs, nausea, loss of appetite, distension, fullness in the epigastric and abdominal area, you will choose 平胃散. 平胃散 in English translation is calm the stomach decoction, which helps you calm the dampness compared to 清胃散, where it's coming from clear heat category. 清 means clear. So the verb of the name and the verb of action indication is really helpful, can give you a guess or help you to understanding what this formula do. And next, middle jiao, vomiting and diarrhea, have fever, chills, headache, fullness, stifling sensation in the chest, 藿香正气散. It's a famous, really famous formula we will carry when we travel. You might easily get upper jiao symptoms plus lower jiao symptoms like fever, chills plus diarrhea. 藿香正气散 is the main formula you should go with. 藿香 is a king herb of this formula and also have the similar function. Speak of this, if you know the category of this formula, you can easily figure out where is the king herb coming from, and then where is the assistant herb coming from. It's most of the time it coming from the same category. So when we categorize all these 16 formulas together in 4 parts, you also can match up all the individual herbs categories in 4 parts. Try it by yourself. If you have any questions, ask me about it. I'll attach the documents for you. So the next one is going for general sensation of heaviness for all body. If you have difficulty in moving, joint pain, like due to wind cold damp, 捐臂汤 is the one you can choose, but we don't commonly got tests on it. And if you see whole body have skin edema, which we choose 五皮散. It's a 5 pills. 5 pill, we commonly linked pill to our skin. So if you use the pills of herbs, you can treat skin condition. Next one. There are 6 formulas in treat phlegm. 二陈汤 is the classic one that we use for like all phlegm conditions at the beginning stage. So you will see a patient have all the nausea, distension, sensation in the chest with lots of white sputum that easily expel. So watery sputum in white color easily expel, we will choose 二陈汤, which is the beginning stage of the pathogens. And later, if you see patient have vomiting and nausea plus 身 disturb, insomnia, dream disturb sleeping, anxiety, dizziness, vertigo, 温胆汤 is the one you should choose. So 温胆汤 is famous psychological formula we should consider when you see patient have nausea, vomiting, plus dream disturbed sleep. Next one, patient have sputum that is hard to expel compared to the beginning. 二陈汤 is for patient have watery white sputum that easily expel. This one is patient have yellow with curious sputum that difficulty expel. Feeling of fullness in the chest, we use 清气化痰丸. Remember to check the English translation for this name. 清, as we mentioned, is clear. 清气化痰丸 clear the qi and resolve the phlegm, mainly targeting heat signs and symptoms. So yellow sputum is the key words for 清气化痰丸. The other one is deep-seated sputum, dry throat, 贝母瓜蒌散. 贝母 is the king herb and also famous for nourish. So when you see 贝母瓜蒌散, you know it can help to nourish the dryness, which helps deep-seated sputum. So there's lots of sputum to differentiate the formulas. One, at the beginning stage, watery white sputum, 二陈汤, and go a little bit deeper interior, yellow sputum that hard to expel, 清气化痰丸, and later it go deep-seated sputum, 贝母瓜蒌散. Okay, the last two is for wind phlegm. So you will see internal wind, dizziness, vertigo, and also you see a lot of sputum, nausea, headache. You can use 半夏白术天麻汤, which helps internal wind, dizziness, vertigo, plus phlegm symptoms. The other one is for external wind, slightly fever chills plus itchy throat, 止嗽散. 止嗽散 means stop coughing. Stop coughing compared to sore throat, which is fully exterior symptoms. Remember, it's from release exterior 银翘散. However, here have more itchy throat with phlegm retention plus mild fever chills. You use 止嗽散. Alright, next one. Are you ready? Expel Wind. Only 4 formulas in this category. Internal wind plus migrating pain in the joint and reduced range of motion. Chronic pain, we use 小活络丹. 小活络丹 also you can use topically, like there's oil form that you can apply on your skin, on your joints if you need it. You can try to make it too. The next one is internal wind, dizzy, vertigo, headache, plus stroke. A distension in the head and all the flush face, mental confusion. 正肝息风汤. 正肝息风汤 is for stroke. The other one, dizziness, vertigo, headache, plus insomnia with dream disturbed sleep. Again, coming back. Insomnia with dream disturbed sleep. Liver, which is the liver yang rising symptoms. Use 天麻钩藤饮. These two is easily confuse you. So one 天麻钩藤饮 have insomnia with dream disturbed sleep plus all the dizziness, vertigo, headache, internal wind symptoms. The other one 正肝息风汤 is more severe. You got stroke. All the mental confusion and the distension in the head. 正肝息风汤. 正肝息风汤 stroke. 天麻钩藤饮 internal wind plus insomnia. Alright, the last one. Itchy, red skin 消风散. If you have internal wind in the skin, you will easily got itchy, reddish, not reddish, redness skin. 消风散. Alright, the last one and the easiest one, we repeat every time, release exterior. Release exterior, we have 5 formulas. 2 for wind cold, 2 for wind heat, and 1 for more muscle layer. So wind cold. At the beginning, we got wind cold, chills, fever, unrelieved by sweating, 桂枝汤. Unrelieved by sweating, 桂枝汤. And later, we have wind cold, chills, fever, absence of sweating, soggy pulse, pain of extremities, 人参败毒散. The only one symptoms, pain in the extremity, under release exterior category, 人参败毒散. Check the translation of the name. You can see release toxic, which relate to the pain. So at the beginning, chills, fevers, unrelieved sweating, remember 桂枝汤. Alright, and then wind heat, fever, mainly fever, slightly chills, sore throat, 银翘散. And the other one, just mild symptoms with cough, slightly thirst, 桑菊饮. So 桑菊饮 is leaf, 桑叶, 菊花 is a flower. Leaf and flower can help mild symptoms. Later, you got more fever, less chills, plus headache, stiffness of extremity. Compared to the beginning, you got pain in the extremity, which is 人参败毒散. This one have stiffness in the extremity, 柴蛤解鸡汤. Fever increase, chills, headache, plus stiffness in the extremity in the muscle layer, 柴蛤解鸡汤.